We want to go to New Jersey now,
where CBS 2's Alice Gaynor is live at the Hoboken waterfront with a look at conditions there. Again, wearing a mask, good idea as a precaution. Alice?
Well, things are not much better over here in terms of air quality, but visibility has been steadily improving since earlier this afternoon. When we first arrived here, there was an orange, thick haze. You really couldn't see anything. Now, if you look across the Hudson River, it's kind of a white, smoky haze, and you can at least make out the buildings that make up the New York City skyline. But with so many people urged to stay indoors, the normally bustling waterfront over here, well, as you could see, it's more like a ghost town. An orange haze in Hoboken this afternoon where the air quality was elevated to hazardous, bad for health and bad for business.
It is sad to kind of see it quiet and not being able to see the view that we normally, again, pride ourselves on.
At the Ainsworth along the waterfront, masks are on and outdoor dining is off.
Of course, we would love to have it outside as the weather is 77 degrees, but thankfully inside we do have, a good amount of seats.
Governor Murphy had this update.
We made the decision to close state offices at 3:30. We're encouraging, as your colleagues have said, young kids, seniors, anybody with heart or lung issues to stay inside. We've encouraged all schools to suspend outdoor extracurricular activity. The Port Authority has our bridge traffic limited to 30 miles an hour because of visibility. It's not good.
In Paterson, New Jersey, a spike in respiratory 911 calls has prompted action.
We're increasing our ambulances presence on the street.
An air quality action plan is now in place. Masks will be passed out in the city. Pulmonologist Dr. Jason Shatkin works in intensive care units in New Jersey and says his private practice has been inundated with 20 to 30 calls a day when normally they would have 2 or 3.
Both patients who have chronic respiratory issues, as well as patients who didn't have any history of having respiratory issues at all.
My Doctor urgent care attending physician Dr. Vino Pauly offers this advice.
close all your windows, use air conditioning, use HEPA filters if you have. If you go out, hydrate yourself, wear a mask.
And in terms of wearing a mask, both of those doctors tell me a mask just like this one is okay, but if you have an underlying condition, an N95 is preferred. Even better, stay indoors. Live in Hoboken, New Jersey, Alice Gaynor, CBS 2 News.
All right, Alice, thank you.